Good afternoon. We're here today to talk about atrial fibrillation. This disease is most common in our older patients, starting from maybe about age 50. The signs and symptoms include nausea, vomiting, a fast pulse rate, the feelings of palpitations in your chest, lightheadedness, and just not feeling right. One of the main comorbidities of atrial fibrillation is stroke because of the risk of blood clots and going to your brain and causing an ischemic stroke. Now, the pathophysiology, first we need to understand how the pathophysiology of the electrical conduction system of the heart normally works, okay? And I've got a little thing here. The signal starts in the sinoatrial node right here, goes down to the AV junction, and then goes down into the ventricles, The one signal, the sinoatrial node, is the main pacemaker of the heart. Now, in atrial fibrillation, as the signal enters the atrium, it stimulates the atrium into where they've got, instead of one signal going through the AV junction and into the ventricles, you have that signal bouncing around, going all over the atrium, causing the atrium to sit there and jiggle instead of pump efficiently. And this is where your blood clots will form. And when they're released, then they can cause a stroke. So that's kind of what they worry about in AFib. Now, sometimes these signals are coming from so many directions, they neutralize each other. So again, the atrium just sits there and quivers. Now, treatment options. Most cardiologists, their number one treatment option is to convert you back into a normal sinus rhythm. That's their main goal. And to do that, lots of times, they use what we call synchronized cardioversion, which is where they hook you up to a defibrillator, and they synchronize the defibrillator to just fire on the QRS complex, on your EKG. And this will, most of the time, convert a normal sinus rhythm, atrial fibrillation into a normal sinus rhythm. Now, some of the other treatment options, of course, are medications. The number one medications for atrial fibrillation include beta blockers, which is one of the most common, such as metoprolol, and I'm on carvedilol. It keeps my heart in a normal sinus rhythm. I have atrial fibrillation also. And then you have the antiarrhythmics, Antiarrhythmics such as sotalol and amiodarone. Drug interactions. Now, antiarrhythmics especially interact with many medications, one of the most common being antibiotics. You really have to watch what medications you take with an antiarrhythmic. There's usually a really long list of stuff that you can't take. Blood thinners is another important one. That's probably, if your heart remains in atrial fibrillation a long time and they can't get it converted, then blood thinners are very important because it'll keep the clots from forming and giving you a stroke. Now, on the efficacy, most of these medications work really well. They'll put you in, usually on the antiarrhythmics, they'll put you in the hospital. They'll build your level up of those drugs, and then they'll cardiovert you into a normal sinus rhythm in hopes that these drugs will hold them there. And then you're on these drugs. Now, expected outcomes, again, are very well. The expected outcomes are to, again, hold you into a normal sinus rhythm. And if, perchance, they can't do that after several attempts, then their goal is to control the rate of the atrial fibrillation, because atrial fibrillation can have ventricular rates up to over 200 if it has what they call rapid ventricular response. So the outcome would be to control the rate below 100. Now, genetics, environments, and lifestyles, a couple of triggers include caffeine. So your lifestyle would have to include caffeine, eliminating caffeine, chocolate, any type of stimulants, And as far as genetics, that can play a part also in atrial fibrillation. Like my dad, sister, and brother all have it. So to some degree, that can play a part. I hope this was useful. Thank you.